Chronic obstructive pulmonary disease, COPD, is a progressive lung disease characterized by persistent respiratory symptoms and airflow limitation. The pathophysiology of COPD involves various complex mechanisms primarily caused by long-term exposure to irritating gases or particulate matter, most commonly from cigarette smoke, but also from environmental pollutants or occupational exposure. Here's a breakdown of the key pathophysiological aspects of COPD. Airway inflammation. Chronic exposure to noxious particles and gases triggers an inflammatory response in the airways. This inflammation leads to the recruitment and activation of inflammatory cells like neutrophils, macrophages, and T lymphocytes. The inflammatory process damages the airway lining and increases mucus production, contributing to airway obstruction. Airway obstruction. The inflammation results in the thickening and narrowing of the airway walls due to increased mucus production, fibrosis, and loss of elasticity. This obstructs airflow, making it difficult for air to move in and out of the lungs, especially during exhalation. Alveolar destruction. COPD also involves damage to the alveoli, tiny air sacs in the lungs where gas exchange occurs. This damage, known as emphysema, leads to the destruction of alveolar walls, reducing the surface area available for gas exchange. It causes a decrease in the elasticity of the lung tissue, leading to air trapping and hyperinflation of the lungs. Oxidative stress. Exposure to cigarette smoke and other pollutants generates an increased amount of free radicals and reactive oxygen species, ROS, in the lungs. This oxidative stress causes further damage to lung tissue and exacerbates inflammation. Remodeling of lung tissue. Long-term inflammation and damage lead to structural changes in the lungs. This includes remodeling of the airways and destruction of lung parenchyma, altering the normal lung architecture and function. Pulmonary hypertension. COPD can cause pulmonary hypertension, where the blood vessels in the lungs constrict and thicken due to chronic low oxygen levels, leading to increased pressure in the pulmonary circulation. Systemic effects. COPD isn't just limited to the lungs, it can also have systemic effects. Chronic inflammation and decreased lung function can lead to complications such as muscle wasting, weight loss, cardiovascular problems, and an increased risk of osteoporosis. Management of COPD primarily involves smoking cessation, bronchodilator medications, inhaled corticosteroids, pulmonary rehabilitation, oxygen therapy, and sometimes surgical interventions in severe cases. Understanding the pathophysiology is crucial in developing effective treatment strategies and improving the quality of life for individuals living with COPD.